Hey everybody, Kris here, giving you some basic tips on foam and ball rolling. When you begin a self-massage and myofascial release regimen, I recommend moving slow and with patient perseverance. There's lots of tools out there now, and people can really injure themselves out. I've had many clients over the years come into my massage practice, and I see these bruises on their bodies, and later they admit that they were using the corner of their coffee table or a bookcase or a corner cabinet to get out that tight spot. So I'm here to tell you, please don't do that. Please don't injure yourself like that. Use these tools and use them intelligently. So let's get started. Tip number one is to decide which tool you need. Foam rollers can be bought in a full circle or the semicircle shape. The latter, the semicircle shape, is really used more for stability exercises and for strengthening the core. Full circle foam rollers tend to be more for releasing muscular tension. So depending on what your therapeutic needs are, you can select the shape you need. They're also coated in different colors which match their density levels. So your beginner type foam rollers that perhaps are a little more soft on the spectrum are going to be colored white typically. And then you have your more intermediate level foam rollers, which are typically colored blue or green. And then you have your most dense foam rollers, which are typically black. And those are processed at a really high heat, so that the roller itself is much more compact and dense. So you get a much deeper pressure and a much more intense sensation when you use rollers that are higher on that spectrum. So find the right shape, find the right color. If you're working with balls, I am a big fan of yoga tune-up balls by the Roll Method with Jill Miller. The balls can be in a variety of sizes, and I use them frequently. Now you can, yes, of course, you can use other athletic balls, tennis balls or lacrosse balls. Use what you have, but I do recommend investing in some of these yoga tune-up balls, which, by the way, I don't get any any affiliate links or perks for recommending them. I just truly use them on the daily and find them so helpful. Often what I hear from clients is, oh, I hate foam rolling because A, it hurts, or B, I'm afraid I'll hurt myself. They don't know how to actually roll on the ball or roll on the roller without fear for slip, a fall, or some kind of injury. So I want to walk you through some simple tips and some no roll zones in the body so that when you start working with your own self-massage release techniques, you can stay safe. Now, there are a couple of regions in the body that are no roll zones. Under any circumstance, you don't want to apply deep pressure to these areas. Number one, the throat and trachea area. No roll zone number two is the Zyphoid process. That small triangular shaped bone at the bottom of your breastbone. Definitely don't want to be rolling there. No roll zone number three is in the inside of your forearm, and especially down toward the wrist when you have it in full extension. We want to avoid aggravating the median nerve, which runs down through this area and into the carpal tunnel. No roll zone number four is the bikini line. Now, for some sustained compression may be tolerable, but I would generally avoid deep pressure in this area and certainly avoid any cross fiber friction unless you're working with a clinician. No roll zone number five, any region of the body with bone density issues, osteopenia or osteoporosis, former fracture in the bone where perhaps the healing didn't go correctly. No roll zone number 6 is the coccyx bone, the teeny tiny bones at the tail of your spine. These break easily, so we don't want to put direct deep pressure from balls or foam rollers or really any tool on that area. And no roll zone number 7 is the sciatic nerve. We want to avoid rolling on the hamstrings with a ball when our leg is extended out in front of us. This just puts direct pressure on that nerve. You can, however, get some really effective rolling and release of the hamstrings by sitting on the ball with your knees slightly bent, and allowing this flexion in the knee and in the hip will allow for the hamstrings to relax a bit. That way you're not working and rolling directly on the sciatic nerve. So I want to talk for a moment about feeling pain and sensations when you're using some self-massage rollers, balls, and tools. Now, I don't like to label pain as either good or bad type of pain. I would rather you think about it in terms of varying degrees of sensation that you're experiencing in the body. Like mindset and your point of reference is a big part of your experience of discomfort and pain. So think about bringing to your mind's eye softness as you're performing your rolling techniques. And if you are encountering that it is too painful to roll using the technique you're using, try these modifications. Number 1 would be to use a larger size ball or roller. This is the yoga tune-up balls that I mentioned in the previous video. They're just slightly smaller than the size of a tennis ball. They come in this nice mesh tote, and the outside has this really grippy, kind of sticky, rubbery material that's easy to wash and maintain. And I like these balls because they grip the tissue so much better. I like these balls because they're much more dense, right? And so they're very firm and can apply the deep pressure and the kind of kneading techniques for those deeper laying tissues and connective layers that need more pressure. And if you find that too painful, then go up a size. These are the alpha balls. So these are about the size roughly of, I'd say maybe a softball. And just to compare it to the alpha ball side by side, you can see how different they are. And by increasing the size of the ball, you're increasing the surface area of the tension being applied. So it's a lot more comfortable if you're experiencing pain as you're rolling. This is their courageous ball, which is larger, about the size of a small soccer ball. And I like to use this on areas like my chest and my belly and rib cage, but it's also good for other areas of the body. So go up a size in your rolling tool if you are experiencing pain. Now the pain that I'm referring to here is a deep kind of achy pain, not a sharp shooting pain. That would indicate that you've impinged on the nerve, and we definitely don't want that. So if at any time you feel that sensation or any numbness or pins and needles or tingliness, then that could indicate the same. So make sure that if you experience those sensations, that you release the pressure from your tool and use one of these modification techniques. Or dampen the intensity. Add a hand towel, a cushion, a t-shirt. Depending on the size of the tool you're using, you can decide what you want to cushion it with. And just by laying that over can provide a muted sensation, and you can always experiment with different layers and folds to get the right thickness that is going to work for you. Okay, we want to always be working within a tolerable range of comfort. There may be some discomfort, yes, but it should be tolerable, not painful. to change your orientation to gravity. A lot of foam rolling and ball rolling is done low or on the ground. Sometimes when you have a lot of scar tissue, or you've been stiff and achy for a long time, or you've got an old nagging injury, you may not be able to get down to the floor or back up from it. So another modification you can use is to bring your tool from the floor to the wall and modify the technique by being in a standing position, changing your orientation to gravity, and leaning your body weight into the wall with your apparatus in between. So those are my tips for how to modify your rolling techniques or your apparatus to minimize your pain and roll safely.